Okay, next we will proceed to the third presentation. The topic is about bridging research and practice, developing handbooks for professional support by PHR. It's my honor to invite Dr. Takehiro SUGIYAMA, the Director of the Department of Medical DX, Bureau of System Infrastructure Development, Japan Institute for Health Security. Dr. SUGIYAMA is also specially appointed professor at the Department of Health Service Research from the Institute of Medicine, University of Tsukuba, Japan. So please join me in welcoming Dr. SUGIYAMA.
Good morning, everyone. So today I want to talk about the developing handbooks for professional support via PHR. This is the same slide from yesterday. So let me move on. So during my yesterday's talk, I talked four things. One is the overview of PHR and digital therapeutics in Japan. And another one is about the umbrella review, the review articles about the PHR. And I introduced two examples of Japanese application of the PHR, the cow meal and PEPUP. So, and the final thing is the introduction of the CBS. So this is the turning the PHR to a representative research platform. Today, I want to talk about the intersection between the PHR and the professional health guidance people. So PHR are effective alone, but more so with provider support. Historically, Japan has run specific health checkups and guidance since 2008, targeting metabolic syndrome in adults aged from 40 to 75. And since then, ICT tools and PHRs are developed, and they have been positioned within the specific health guidance framework. And the fourth term project has started since 2024, and it introduced outcome evaluation. So providers are assessed on whether behavior and the biomarkers are actually improved. So the government changed the subsidy, the size of the subsidies, looking at the size of the effect. So providers are encouraged to enhance their guidance with ICT PHR tools while checking each person's attitude and ICT literacy. So we conducted interviews study. So we, instead of listening to the participant, we listened to the practitioners. So participants are 22 practitioners of the health guidance, and we conducted 5 focus group interviews. That in December 2023, and we used the grounded theory approach, and we used the NCD to the thematic analysis. And what practitioners told us is that there are 3 function pillars about PHR. So self-monitoring, and goal settings, and messaging. So self-monitoring means that they can check their, they can record their weight, And the steps may be automatically recorded from their smartphone, or they can record their meals. And goal setting means that they can say that, okay, reducing 3 kilograms during these 3 months is my goal, or something like that. And messaging and chat is the in some cases, I think the AI or these things can give message to the participant. But in this case, the practitioners will send a message to the participant of the health guidance. So this is with a human in the loop. And who it fits, so who will be the good candidate for the health guidance with the PHR. So in our previous study, I showed that the middle age or on the male people are more favorable users of the PHR. But many practitioners say that attitudes or motivation, ICT literacy, and personality are more important than age or sex. And male people tended to prefer visualized weight and activity data. So they may want this like scientific information to know about their health status, but the motivation and personality is more important. So their age and sex are not totally predictable. And when it matters, so as human stepping in within the first month is very important, and not because I should figure that the retention rate drops significantly in the first month in Caroline study. So the stepping in within the first month is very important. This is also shown in our interview survey. And the core finding is that how PHR user drives behavior change. So we think that monitoring is a core part of the PHR use, and they change it to the awareness to their health condition, and they set their goal with looking at their health status and their awareness of their health condition. And after that, the PHR can reinforce their motivation and their conduct of the healthy behavior using the chat and these things. So monitoring in the engine and the human will close the loop. So there can be the loop and the self-regulation. And this is a conceptual model. Unfortunately, we wrote this one in Japanese, and some Chinese character can be read for the Taiwanese people, but I changed it to the English one. This is just a tentative English version. So this is my own translation, but I think with the collaborator, we will make the formal version, the formal English version later. Yeah, so this is the timeline, right? So this is the start of the guidance, and from 1 month to 6 months, and 6 months later, and these things. And this is the interaction with the PHR, and this is PHR and the health professional. So at first, they need to know the health condition at that time using the PHR. And first of all, not every person does not understand how to use the PHR. So it is quite important to show how to use the PHR personally in person. They say that without this process, quite amount of people will drop out from the PHR project. And also, looking at these data, they can help the goal setting. And there is a chat and message during this process, and the proportion of the importance may become smaller during this process because they get accustomed to what they learn from the teacher, and the self-monitoring itself can become smaller because they know that, they understand, oh, this is what we eat. So they can measure what they eat, and they get a feedback from the app that, oh, this is like 2,000 kilocalorie. But after doing this 1 month, I think they can understand, oh, this is like about 2,000 kilocalorie, or like 1,600 or 1,600 or something like that. So I think they can learn a lot, and it's also good. So becoming small is not a bad thing, right? So they learn a lot, so they can stand on their own. And after that, so continuous support. So I think after getting accustomed, they will stop using the application, or they eat a lot afterwards. So support to prevent rebound is also important. So after writing this conceptual model, we proceeded to the making the proceed model. So predisposing factors are the awareness or ICT skills or these things. And enabling factors are these functions, right? Monitoring function, messaging function, and these functions. But another important source is about function is reinforcing factor. So hands-on support for using it, or team participation, or the professional communication, messaging, or these things. So this is the proceed map written in Japanese. So I also translated it in English. So because this is a proceed model, it can start from the social assessment here, and the assessment is from to here, and the implementation is the phase 6, and after that there's an evaluation. And here, this is the support factors, and this is enabling factors. But what we think important is the reinforcing factor. So the health professional will help the participant to improve their behavior, and they will give the feedback and the encouragement and these things. And it will change their behavior, and it will improve their health status. And the final thing is that it may or it will change the quality of life. So we compiled this information in a small handbook, so booklet like 15 pages for promoting PHR service use among health guidance recipients in non-communicable disease prevention programs. This is also written in Japanese, so this is like this is point 3. What does effective use look like? Which function you use how? And this is like a 2-step for aiming to the aiming for the behavior change and health outcome. So step 1 is like first 1 to 2 weeks. We need to focus on motivation and lead to individual goal setting. And the second step is like from 2 weeks to 1 month. So reinforce behavior and build habit. And this is schema we wrote. So this is the knowledge and predisposing factors, right? And after that, there's a goal setting, and they need to start the action, and looking at the result of the action, they need to evaluate the action. And after that, looking at the goal, if the goal is not satisfied, they need to go back to action, or they may reset the goal afterward. So there's a round, and during this process, the self-efficacy will be raised, and after that, habit will be formed, and this can be the tentative goal for the PHR use. During this process, PHR itself is very supportive, and in addition, the PHR and professionals are very important. So using PHR service support, so motivation support and goal setting and support for reinforcing behavior and or at the first time, assessment of aptitude for using the PHR service. It is also important because if the person is not a good candidate for the PHR use because of the literacy or what they have or their PHR impairment or these things. In that case, they will change the way. So this cannot be done from the AI or robot. So I think human professional is still important. Although the proportional importance can be gradually replaced by this technology, but they are still important, I think. So this is the final slide. What we did is we interviewed practitioners, and we built a behavioral change model, and we developed a handbook. Thank you for listening.
Thank you so much, Dr. Tsukuyama, for your insightful talk.